So we're heading into section 2, what you can do to feel better, and we're going to talk about strategies for both tissue and nerve pain in this video here. Uh, but broadly, we want to just talk about pain neuroscience education. We mentioned that at the outset, um, and this education in what pain is, what drives pain, why we have pain, helps make the threat smaller. And basically, the course so far, and as we continue, this is pain neuroscience education. It's something that's been around for a couple decades, actually, but just hasn't reached the mainstream yet. And that's often the case. In general, things that are researched and found in research usually take about 17 years, give or take, to reach the general population, even the general healthcare sector. But one thing that was interesting, and I've been practicing for 25 years, we were so often focused on when somebody's in pain, teaching them about the anatomy of the location that hurts, but rarely did we teach them about pain in general. And yet people came to us not for an anatomy lesson, but to know what pain, a pain lesson, if anything, what's driving my pain. And so this whole approach, pain neuroscience education, you might hear it called pain science education, therapeutic science education. There's a lot of terms, but the general idea is giving people an understanding of what their body is doing, what their mind, their nervous system is doing uh, when we feel pain. And that takes the mystery out of a lot of what we feel, and that makes the threat smaller. And so, just some interesting statistics here. There's a concept, particularly in the medicine world, the pharmacological world, of numbers needed to treat, NNT. And we know a lot of people in pain will use medication, and there's nothing wrong with that, and sometimes they're very appropriate. And a common pain killer or nerve pain medicine is gabapentin. And so there's a number needed to treat ratio of 6 to 1. What does that mean? This is the reality that they found, and this is accepted, that 6 people need to be treated with gabapentin for one of them to feel relief from it. That means 5 other people will take gabapentin, and it's understood that the statistics say 5 people will not have relief from gabapentin. Antidepressants are often prescribed for pain because, as we're seeing how the brain is involved, it can help, but it also has a high numbers needed to treat ratio, 7 to 1. 7 people have to take antidepressants for pain for one of them to benefit from it. But interesting with this pain neuroscience education, it's been found that uh, only 3 people have to be taught pain education for one to benefit. And from a function standpoint, to improve in function, pain may stay the same, but teach 2 people pain education, one of them will improve in their function despite the pain. So very little side effects from pain neuroscience education compared to other interventions like medications. Again, we're not against medication, but as we're seeing, medicines are generally not the silver bullet. They may play a part, but more is needed. And so, particularly, this pain education is most effective not just from getting it, but then combining it or using it as a foundation to do more and generally to move. That's one of the most important things. If we can make you feel safer, understanding what's driving your pain, what pain is safe to work with, what pain isn't, uh, the safer you can feel, the more you'll be likely to move. But one thing that I've learned I have to really reiterate. We've talked a lot about the brain and pain. Uh, People will feel that, oh, so you say it's all in my head. You think I'm making this up. Absolutely not. All pain is real. All pain comes from our brain, just like most everything in our life comes from our brain. But it doesn't mean you're faking it. The term psychosomatic has such a negative connotation. and we don't like to use that there. It's the brain and this amazing nervous system of ours making pain to protect us. And so the pain is real. It's not all in our head, it's in our brain, but that doesn't mean it's fake. It's 100% real. And how have you felt as you've learned some things about the body, about MRIs, about how the brain works? When we've been told one thing for much of our life, to hear some things that may contradict that can be a little difficult to process at first. And one might feel, well, I've suffered for so long, I didn't know that a bulging disc could heal. And it could rightfully make you feel angry, upset. Um, and we're not trying to make people upset. We're not trying to invalidate. We're just trying to share what's been found and what's been helpful. Um, but never take this education to mean that you're not in real pain. You're definitely in real pain. All pain is real. And hopefully you can use this pain education as a foundation uh, to do more in life, to engage more in life, and actually to feel less pain. So let's get into strategies for tissue pain. So tissue pain is really, like we said, more of that acute pain, that fresh pain. You just had an injury and now you're in pain. Let's say you sprained your ankle. So what do you want to do with tissue pain? Well, you want to let your body do what it does best, which is to heal. I always say a split second after your injury, your body has gone into a response to try to heal your tissue. You don't ask it to do it, it does it automatically. Like so much of what the brain and our nervous system does is mostly out of our conscious control. So for tissue pain, let your body do its job, promote a healing environment, allow tissues to heal properly. So we talked about sometimes nerve pain comes from us not allowing an initial injury to heal properly. So listen to your body. The pain is there for a reason. As things heal, the pain should subside little by little to allow you to do more and more. So it's important to control the pain. So taking some kind of painkiller could be appropriate if you are into taking painkillers. Some will use electrical stimulation. Uh, Ice was always a big thing that was recommended. Now there's some question. We're not trying to kill inflammation. We want inflammation. Out of control inflammation we don't want, but we do need some inflammation after an injury. Sometimes ice, though, can slow nerve conduction so that we don't feel so much pain because we're slowing the danger signaling. So uh, sometimes a little heat, if you're not too swollen, can be comforting too. Everyone's individual. You want to control the pain so that you don't get overwhelmed by the pain. And just remember, chronic pain often has developed from an acute injury that was poorly controlled. And so depending on the severity of the injury, if you're seeking help, if you've been cleared to mobilize the area, you want to mobilize it as soon as it is safe to do so. And so gone are the days of long-term bed rest. So when we've tweaked our low back, often it would have been weeks of bed rest. And what's been found is that's one of the worst things we could do for low back pain. In fact, we generally want to get moving right away. And in fact, handing out neck collars after a whiplash injury, if we've been cleared of any kind of fracture, generally we don't want a neck collar. Why? Because now we're avoiding movement. If we don't have to avoid movement, if it's safe to move the tissue, it just hurts, we need to mobilize the tissue. So ER or emergency departments are giving out neck collars less and less after whiplash to promote early movement. And when you're having to rehab an injury, we don't wait till there's no pain to get started. We'll always have to initiate movement with some discomfort. And that's why we always talk about that pain scale, 0 to 10, 10 being the worst you ever felt, working into 3 out of 4, depending on your sensitivity. But remembering this phrase, hurt does not necessarily equal harm. So creating that physical healing environment, and then our mindset. Our mindset's important. How we're feeling emotionally through the experience. We want to minimize stress because Stress can activate our sympathetic nervous system, create these stress chemicals flowing throughout our body, activating more of the danger signals, sensors, causing more pain. So our goal, we want to restore range of motion, strength, balance, whatever orthopedically was injured, try to get it back to where it was. And there's a nice new phrase that's being used for fresh tissue injury or acute injury, and it's called peace and love. And basically, when you have a tissue injury like an ankle sprain, sure, you want to protect it first, elevate it. But interestingly, more and more avoiding the anti-inflammatory medication because we actually want some inflammation to promote the healing. And as I mentioned earlier, ice sometimes can help to relieve pain, but we don't want to stop inflammation too. So there's a little debate over that. Compressing a swollen area is also helpful. Education. So sometimes too much intervention can just perpetuate threat or the perception of threat, perpetuating this pain response. So avoiding unnecessary imaging and passive treatments is important. So that's the peace. Now, where's the love? So loading. So as we're able to put more load onto the injured area, like an ankle sprain, you want to do that up to that 4 out of 10 discomfort. Here, the mindset is really being understood to be a very important factor in our healing, being optimistic. So having the confidence and positivity about our body's ability to heal. Blood flow. Blood is life. So we want to make sure the area has blood flow. So vascularization, aerobic exercise, working around the pain, keeping yourself mobile, and then exercise to the area, moving it, activating it there when it's safe to do so.